Look at your feet right now. High blood sugar starts damaging your nerves and blood vessels years before any doctor diagnoses you, and the first place it shows up is on your feet. Today I'm going to show you 9 signs that are already on millions of feet right now. Signs that can tell you what a blood test hasn't yet, if you know what you're looking at. Last month, 67-year-old patient felt fine, healthy lifestyle. He had 4 of these signs. His blood sugar came back at 214. He'd been diabetic for over 2 years without knowing it. Sign number 9 on this list. Almost no doctor puts it in a brochure. But once you see it, you'll never unsee it. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people. Your body has been signaling you. Here's what those signals look like, starting with the one almost everyone has already experienced and explained away. Here's what's happening inside your body. High blood sugar does 2 things at the same time. It attacks the coating on your nerves, like an acid slowly eating through the insulation on an electrical wire. And it narrows your blood vessels, like a kink in a hose that stops oxygen and nutrients from reaching your feet. Those 2 processes produce everything we're about to go through. They start quietly. They progress slowly. And your feet are the very first place they surface, because your feet are at the end of the longest delivery route in your entire body. Let me show you exactly what I mean. Sign number 1. Start here, because this is the one almost every patient has already felt and already explained away. Tingling. Numbness. That pins and needles feeling in your feet. You cross your legs for a few minutes and your foot falls asleep. Everybody knows that. But I always ask my patients one question. Is it happening regularly without a clear reason? If yes, here's what's actually going on. When blood sugar stays elevated over time, it begins attacking the outer protective layer of your nerves. The coating that allows electrical signals to travel cleanly from your brain down to your foot starts breaking down. The signals get fuzzy. That fuzziness is the tingling you feel. The American Diabetes Association reports that peripheral neuropathy, nerve damage, affects nearly 50% of people with diabetes. It is the single most common complication. And it almost always starts in the feet. Here's what I tell every patient. A 20 to 30-minute walk every single day. Not a jog. A walk. Movement is the best thing you can do to keep blood flowing to those nerve endings. And start cutting added sugar today. Not next month. Today. Roll your foot right now. Feel any tingling? Any areas that feel different from the other foot? Note that. It matters. Moving on. That sign alone is powerful. But what I'm about to show you next makes it twice as important, because most people experience this one at the exact worst time. This next one surprises most of my patients because it doesn't hit during the day. It hits them at night when they're trying to sleep and there is nothing to distract from it. A burning sensation in the soles of the feet. My patients describe it as the worst kind of restless. They can't get comfortable, can't cool their feet down, nothing seems to help. Most chalk it up to being on their feet all day. Or summer heat. Here's what's actually happening. The nerves in your feet have already been damaged by excess sugar. And now they're sending incorrect signals to your brain. Think of it like a fire alarm with a faulty sensor. The building is not on fire. But the alarm is going off anyway because the sensor is broken. Your brain is receiving a heat signal when nothing hot is touching your foot. The nerves are misfiring. Research published in the journal Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often presenting 1 to 3 years before formal diagnosis. 1 to 3 years. The body knew. 2 habits to start immediately. 8 glasses of water every day. Your kidneys need hydration to flush excess glucose. And add fiber to every meal. Vegetables, legumes, oats. Fiber slows sugar absorption. That is exactly what those damaged nerves need. While we're on the subject of damage your feet can't recover from, I need to spend 60 seconds on something that sends more people to the emergency room than any other sign on this list. If you've had a blister, a small cut, or broken skin anywhere on your foot that hasn't healed in more than a week, that is not normal. When blood sugar is elevated, the tiny blood vessels in your feet narrow and stiffen. Oxygen, white blood cells, and the nutrients that repair tissue cannot reach the wound fast enough. The CDC reports that diabetic foot ulcers lead to over 100,000 non-traumatic lower limb amputations per year in this country. Almost all of them began as a small wound someone ignored. Tonight after your bath or shower, Sit down. Look at both feet. Look between every toe. Look at your heels. Any cut, any blister, any broken skin. Clean it, apply antiseptic, cover it. If it hasn't improved in 48 hours, call your doctor. Not next week. 48 hours. So why does your skin start cracking, even when you're moisturizing every day? That's sign number 3, and the answer has nothing to do with your lotion. Here's what I've never seen covered in a patient brochure. And I tell my patients this directly because they always look surprised. Cracked heels in winter. Extremely common, usually dry air, often fixable with lotion. I get it. But when your heels are cracking in the middle of summer or no moisturizer helps no matter how consistently you use it, that is a completely different problem. Diabetes affects a specific class of nerves, your autonomic nerves. These control automatic functions you never have to think about. One of them is regulating moisture and sweat in the skin of your feet. When those nerves are damaged, your sweat glands stop working properly. Your feet lose their natural moisture from the inside out. No amount of lotion can fix the root cause when the root cause is a damaged nerve. I use this analogy. Think of your skin like a wall that needs to stay sealed. When those autonomic nerves are damaged, the mortar between the bricks starts crumbling. Cracks appear. And those cracks, in a foot with already compromised circulation, are open doors for bacteria. The American Podiatric Medical Association identifies chronic hard-to-treat heel cracking as a significant indicator of autonomic neuropathy in seniors, directly linked to long-term elevated blood sugar. This is not a skin problem. It is a nerve problem. Here's what you actually do. Moisturize your feet every single night before bed. A good lotion or pure coconut oil on the sole and heel. But, and this matters, never apply moisturizer between your toes. Trapped moisture between the toes breeds fungal infection. And drink your 8 glasses of water. Your skin hydrates from the inside as much as the outside. Quick question. When did you last check your own heels for cracking? Not when you had a problem, just as a regular check. If the answer is never, that changes after today. Here's one more your eyes can catch right now. Stand up and look at your ankles. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes color. You may see darkening, a deep reddish tone, or even a slight bluish tint around the ankle area. In some patients, the skin also becomes thinner, more fragile. Your skin is telling you the blood deliveries are running late. A study in the Journal of the American Academy of Dermatology found these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months of your body trying to tell you something. 5 minutes of ankle circles, toe raises and calf stretches every morning. Even that small amount of movement forces blood flowing back into the feet. And if you're sitting for long periods, elevate your feet. Even a few inches on a footrest makes a meaningful difference. Your doctor may have told you to take ibuprofen for your foot pain. Sign number 4 is exactly why that advice could be making things significantly worse. If you only remember one thing from this video, make it this. I've heard this story dozens of times from senior patients, mostly men. I've been taking ibuprofen for the foot pain for months. I figured it was arthritis. Maybe an old sports injury. And sometimes that's exactly right. But sometimes the pain has a completely different origin. One that ibuprofen will never touch. Here's what I mean. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive. Instead of going numb, they start firing random, intense signals that your brain interprets as severe pain. Stabbing. Electric shocks. A hot needle through the foot. It happens most often at night when there are no other sensory distractions. Think of a car alarm damaged in a fender bender. Every few minutes it starts screaming for no reason. Nobody is breaking into the car. The alarm is just broken. That is exactly what a damaged nerve does. It sends alarm signals to your brain when nothing is actually happening. The pain is completely real. Its source is nerve dysfunction, not injury. And here's the part nobody talks about. Taking ibuprofen to manage that pain doesn't fix the nerve. What it does is silence a signal your body is desperately trying to send you. You mask the alarm. The damage continues. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes, and it is regularly mistaken for arthritis, tendinitis, or age-related joint pain. Here's what actually helps. Every morning, 5 minutes of gentle foot and ankle stretching before you get out of bed. Flex your feet, circle your ankles, pull your toes back gently. Get blood moving before you put weight on them. And every night, a 3-minute gentle foot massage. Light circular strokes along the sole and up the ankle. This one is for you. Are you currently taking ibuprofen or a pain reliever regularly for foot pain you've written off as just age? If yes, bring that up at your next doctor's visit. Specifically, this is the one that tells me how far things have already progressed. Cold feet. Everyone has them. But I ask patients 2 questions. Are your feet cold in July? Are they cold under 3 blankets when the rest of your body feels warm? That's where I get concerned. Persistent cold feet, regardless of external temperature, are a strong indicator of significantly compromised circulation. Your blood vessels have narrowed or stiffened to the point where warm blood simply isn't reaching the tips of your feet in enough volume. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans with diabetes as the single largest risk factor. Cold feet are one of its earliest and most consistent symptoms. The best response: a 30-minute brisk walk every single day. Not a stroll. A purposeful, arm-swinging walk. Start with 10 minutes if 30 feels like too much. The important thing is to start today. Everything we've covered so far, the numbness, the burning, the cracks, the pain, those all prepare you for what I'm about to show you. Sign number 9 is the one I personally look for on every single foot exam I do. And almost no patient has ever noticed it themselves. This is the one I've never seen in a patient brochure. The one I have to actively point out, because patients are almost never looking for it. But once you know it, you will never stop checking for it. During a foot exam, I look at the lower legs and the tops of the feet. And sometimes, there's a visible absence of hair in those areas. The patient looks down and says, "Huh, I never noticed that." And that is exactly the problem. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs stop receiving what they need. Over time, they stop producing hair entirely. That hair loss is a visible marker of blood vessel damage that has been progressing, in many cases for years. I tell my patients this: think of hair follicles like small plants in a garden. When the irrigation pipe narrows, the plants don't die immediately. They just gradually stop growing. The absence of growth is a message about your blood vessel health. A message you can see with your own eyes, every time you look at your legs. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. Physicians are specifically trained to check for this sign. But most patients would never notice it on their own. Here's what I'm personally asking you to do. Right now or right after this video, look at your lower legs. Look at the tops of your feet. If the hair is significantly thinner than the rest of your leg, or missing entirely, I want you to schedule a blood glucose test this week. Not this month. This week. A fasting blood glucose test costs approximately $12 at any certified lab, and it's covered by Medicare for most of you. $12. That is the cost of knowing. I tell my own family this: that sign, that quiet absence of hair, it changes the picture of everything else. It means the blood vessel damage has been building for a long time. And if it's there, you need to know now. I want you to pause this video right now. Go look at your lower legs. Look at the tops of your feet. I'll be here when you come back. Let's do this together right now. You might want to save this video for this part. Sit somewhere comfortable. Take your shoes and socks off. Prop one foot up where you can see it clearly. First, look at the skin. Is the color consistent? Any darkening around the ankles? Any reddish or bluish patches? Now press gently on your ankle with one finger and release. Does an indentation stay there for a second or two? That is pitting edema, worth mentioning to your doctor. Now look at the heel. Run your thumb across it. Any cracking? Any areas that feel rough or broken? Is this cracking that has persisted despite regular moisturizing? Now check between every toe. Every single one. Any blisters, cuts, or broken skin you hadn't noticed. You'd be surprised how many patients find something during this check they had no idea was there. Now look at the lower leg, from the ankle up to the knee. Run your eye across it. Is the hair noticeably absent or sparse compared to the upper leg? Note it. Finally, close your eyes for 5 seconds and just feel. Any tingling? Any unusual sensation in the sole of the foot, the heel, the toes? Any sense that the feeling is different from what you'd expect? Open your eyes. Now do the other foot. This whole exam, the real version, both feet, takes about 30 seconds. I'm asking you to do this every single night before bed. Not once. Every night. Because the earlier you catch a change, the more options you have. If you want to subscribe, here's why I'd say it. This is exactly the kind of thing I walk my own patients through. Every week I make a video like this one. Something you'd normally only hear inside a doctor's office. If that's useful to you, subscribe. I'll be here every week. Tingling or numbness. Early nerve damage. Burning feet at night. Nerve misfiring. Slow healing wounds. Get any cut checked within 48 hours. Skin darkening around the ankles. Circulation warning, 18 months ahead of diagnosis. Heel cracks that won't respond to lotion. Autonomic nerve damage, not a skin problem. Swollen ankles with sock marks. Kidney stress from elevated glucose. Severe foot pain you've been calling arthritis. A nerve alarm you may have been silencing with ibuprofen. Persistent cold feet even in summer. Blood vessels narrowing. And hair loss on the lower legs and tops of the feet. The quiet sign almost nobody notices. 9 signs. 9 chances to catch something before it catches you. Which number surprised you most? Drop it in the comments. I read every single one. Save this video. Come back to the guided self-exam section. The foot check we just did together. Use it again tonight. Then use it every night this week. Those 9 signs cover what's already visible on the outside. But there's one nutrient that determines whether any of this gets better or keeps getting worse. And most people are severely deficient in it after 60. I made a full video walking through exactly how to use it. Watch it next.